Welcome to the Combinations Podcast, the podcast from North Staffordshire Combined Healthcare NHS Trust. My name is Kyle, the Digital Content Lead, and today we are looking into what advanced practice is. We have Advanced Practice Week, and we have invited some of the advanced practitioners onto the podcast to just talk about the role and the impacts and benefits that it has for the trust and the service users and patients. So I'd like to welcome all the advanced practitioners and the trainee practitioners onto the podcast. So who have we got with us today?
Hi, I'm Sharon Kalizak. I'm an advanced nurse practitioner.
I'm Phil Wardle. I'm an advanced nurse practitioner in older adults.
I'm Janine Burgess. I'm an advanced practitioner in older adults community.
So I'm Rachel. I'm a trainee advanced nurse practitioner.
I'm Anna. I'm one of the trainee advanced nurse practitioners with the older persons team in the community.
I'm Melanie Richards and I'm an advanced nurse practitioner.
Well, welcome everybody. Obviously, for the listeners of the podcast, because this is out in the public domain, it's for anyone to listen to. So an advanced practitioner might be something that they've not heard of before. So I'm going to ask the most simplest question is, what is an advanced practitioner?
So it's a registered nurse who's got significant experience, who's usually done a higher level of kind of training, usually a master's level.
Brilliant. And my next question was, how do you obtain to become an advanced practitioner? So is it through a qualification through university? Is it something you can do as a work placement? How can you go from being, just in a nursing role to proceeding to go and get this qualification?
So it's a blended way of working. We kind of do a lot of on-the-job working alongside academic work at master's level. It's a 3-year course where we complete varying modules in advanced leadership, physical health assessment, prescribing for some people if they aren't already prescribers, clinical decision making, and various few others. There's some elective modules, and then finish that off with a dissertation, which is usually a project based within your area of work.
And today we've got I think, is this the first time that you've all been together, because I imagine you're all on different services and different wards. So I imagine it's not common for you all to come together unless if it is about a meeting about advanced practitioners.
I have spent some time with Sharon, short time, and with Melanie. Spent a lot of time with Phil and some with Anna. Lucky enough to go around doing some rotations throughout older persons, and then at the end just seeing what other colleagues do in their area of practice, which was really helpful.
And is it an independent role to, let's say you worked on a ward, you would just work with that ward as that role, you wouldn't collaborate with others unless if you wanted to innovate and bring something to the role?
When I was trainee, I did rotate around wards, different community teams to get different experiences, which was helpful, and then went back to my community team at the end of the course. And
you talk about, like, you've been on the training, you've done rotation. Where did you do some of your placements and rotations?
I did some over at FEAU at UHNM, and then I did some on Ward 7, some with the outreach team, mental health liaison, care home liaison, memory clinic, so quite a varied rotation really.
And for the trainees that are on the podcast, how are you finding the rotations and the stuff you're learning as you go through this qualification?
So as part of my health assessment module, I was able to spend some time at a GP surgery. So I found it really helpful to sort of enhance those physical health skills by being able to go to different clinical areas. And it's definitely been helpful sort of bringing that back into this role, the knowledge I've been able to gain.
I would totally agree with what Rachel's just said. I've thoroughly enjoyed my rotational placements. I've got to see things from a very different perspective and my knowledge has grown, and therefore it's benefited our patients. So I've thoroughly enjoyed moving around the wards and different organisations. It's been very good.
And as trainees, are you learning on the job essentially, like almost like an apprenticeship where you get the experience through the rotations?
Yes, definitely.
Yeah, so we're lucky really. We sit in a supernumerary post, so we do have obviously time in clinical practice to learn, and then we also get protected time out of that for like university commitments. So it is, a good role. You've got a lot of flexibility to accommodate your learning.
I think one of the really good things is that, obviously working alongside the other AMPs and with the medics as well, they're very, very supportive to help enhance our education and knowledge.
So I guess the question I want to ask is, what happens on a day-to-day basis as an advanced practitioner? What do you get up to, through complex care and patient care and anything, that goes on that's different to, traditional roles on the ward or community?
We tend to cross those traditional roles in practice. We, from a clinical perspective, we could review patients' mental state, full holistic assessments, commence treatment, and we could support a patient all throughout the journey and throughout the recovery. Obviously engaging with family and carers. And there are other elements of our practice is research, leadership, as Phil mentioned. So sometimes we might do a quality improvement project, have a look at the research that's out there, implement that into practice, and then obviously we incorporate the rest of our MDT in that as well.
Yeah, I think it does depend kind of where you're based. I think kind of community can sometimes be a little bit more varied. I mean, I work in kind of a crisis team, so it's hard to plan your day because you're not always sure what's going to be thrown at you. But generally along the same sort of themes as what Sharon's spoke about. So kind of advanced practice is about that advanced practitioner doing that initial assessment, making formulating a working diagnosis, a treatment plan, and carrying that through. In perhaps some of the traditional way that would have usually been left to our medical colleagues. I think, again, that reflecting what Sharon said, it is that kind of crossing the boundaries of being nurse and into medic as well. Sometimes you kind of feel like you're a little bit in between the two.
And I think that's what it is, isn't it? The role is a different approach to medics, isn't it? It's an advanced practitioner is an alternative to role. Is it actually new to the NHS? Obviously, we're raising awareness of it because of the week that has been given to sort of talk about advanced practitioners. But how new is it to the NHS to have advanced practitioners?
I think I was in the first wave for training. So that was 2016.
So it is quite an innovation then, isn't it? It's quite new to the NHS, and the recent podcasts that I've been doing all over the different sides of the North Combined Trust. We've talked about Wellbeing College, and we had the parent and baby, and we've been talking about most of the time is culture change. And I think this is one of those culture changes within the NHS that, we're not trying to replace the medics, but we're given an alternative solution that can challenge the problems in the community and on the wards in a different perspective. So what are the benefits then? We've implemented this, and it's, to me, quite fairly new. If it's within 10 years, that's still quite new to me. Obviously, what are the benefits of having an advanced practitioner and the trainees in these services and teams?
From a trainee's perspective, I really feel that they get more timely with their interventions with an AMP that's able to go out there and see somebody, and also be able to liaise with the GPs with regards to the physical health side of things.
Sometimes as a practitioner as well, obviously advanced practitioners aren't all from a nursing background, but predominantly I think in our trust they are currently. But speaking from a nursing perspective, it also gives that nursing edge to a more advanced skill as well. So things like around, prescribing medication, for example. As a nurse, I know that certain medications when they're given in liquid don't taste very nice, because I've had them passed back to me or delivered back to me in a different way because they don't taste a certain way. And it's kind of having your experience as a nurse kind of on the shop floor of delivering that kind of care firsthand that is imprinted in your memory as a nurse. And then that, well, if I prescribe that medication or this is how I need to treat this patient, you almost give that caveat and say, well, let's try this, but if you mix it with this, then it might taste better and it'll be more palatable for you. So sometimes it's those experiences of kind of being on the ward or being in the community, delivering direct care, that sometimes our other colleagues haven't had that experience. It brings that wealth of experience as well.
Yeah, I think what I was going to say kind of builds on what Phil says. It sort of bridges that gap between the nursing team and the medical team and provides that more sort of continuous, well-rounded care. Because I think sometimes, like Phil was saying, our medical colleagues can sometimes not think the same as a nursing team. We've got that more sort of ward-based way of working with patients. So it's a good way of bridging the gap, I think, and keeping the care well-rounded.
And I think that's it, isn't it? I talked about it just being a different way of thinking. And I think it allows, the experience of being on a ward or in, wherever situation you're working in, you've got that experience of knowing that patients aren't going to like the taste of that, but being able to offer it in a way that, still gets the job done. And it sort of is the hybrid role of a doctor and a nurse. It's that middle ground, and it is building that sort of foundation of, better ways of working, but also efficient, and keeps the place of work happy. So, and it sounds fun, I must say. You all seem to be smiling about, the role and what you guys do. What do you? Love's a strong word. It's the question I got. What do you love about your job? What brings the passion to work? Because in the NHS, you have to be compassionate and you have to enjoy your job. We don't have to, but it helps, doesn't it? I just want to know, as an advanced practitioner, what gives you the kick to come to work and get out what you want?
For me personally, it's seeing the patient recover. With working in an acute setting, seeing the patient, unwell at the point of admission, and it's rewarding, and it's nice to be a part of that patient's journey and knowing that I've played a part in that.
I think it's been responsive and being able to respond to patients quicker in a more timely manner than having to wait to see a medic. So we're historically where somebody's quite complex and they too complex for a nurse but may need to see a medic, that we can kind of bridge that gap and respond quicker, and that's quite satisfying and rewarding on a day-to-day basis.
I think for me it's adding on to what Sharon was saying about following that journey of recovery and knowing that you've kind of had a bit more of an active part in that. It might have been that you who's initiated that treatment or suggested that therapy or whatever, and seeing someone kind of recover, but also as well to kind of show that there's another kind of career development path for nursing as well. I think when I first qualified, it was if you wanted to kind of progress, it was more in a management route, but to kind of see leadership and clinical leadership in advanced nurses, I find that really satisfying as well.
I think again mine builds quite nicely on what Phil said. So it's nice that I have been able to progress in my career and I have been able to really sort of enhance my knowledge and practice, but I've also kept the main part of the job which I've enjoyed, which is a nursing acutely unwell people in an inpatient setting. So it's sort of given me the best of both, really. I've progressed, but I've equally been able to keep the fundamentals of the job, which I've always really enjoyed.
I thoroughly love working with older people, and I just feel now that I can support and improve their quality of life. And I think also being able to share that knowledge with other team members, so it's like a ripple effect and it improves the quality of care that we're providing. I very much enjoy it.
I think it's about having that kind of direct impact, isn't it? On patients' lives, patients' journeys, recovery, and also I think there's a part of kind of your own kind of personal and professional growth, and giving something back, into the NHS and being involved in the the development of lots of things that are opportunities that we've got and exciting developments.
And I think just listening to all of you, obviously it is about staying within that patient area. You love obviously working with the patients and seeing them recover and get better, and obviously it allows you to, as nurses, have something to aim towards. As you mentioned, it's that sort of like, instead of going into management, which is what happens in the NHS when you get to the sort of the top, the next steps is to manage the teams and do all of that. So to have another option that allows you to keep pursuing your medical side, because that's what it is, isn't it? You want to keep on the medical side of the NHS. This role is perfect. It gives you more advancements, obviously, in the name of advanced practitioner. And to me, from someone who's not clinical, the understanding I've got today is obviously it's either nurse or doctor on the ward or medical, and this role is sort of in between that, isn't it? It's the nurse, between the nurse and the doctors, but also keeps it close to home, essentially. So I just want to ask, though, obviously you lot are all on the journey, and some of you been through it, some of you going through it. What would you say to maybe a nurse that might be listening to this podcast who is thinking of what do I do with my career? Where can I go? What would you say to advise them or inspire them to think about advanced practitioner?
I was just going to say, I think it's really, if you want to try to look down that route, why don't you contact one of the AMPs and see if you can just shadow them for the day and have that experience? But obviously, it's you can shadow so many different AMPs in so many different areas. The experiences are vastly different, and just to see how things go. But I would definitely say, I mean, I've just turned into my 50s and I've just started a master's. I think don't let your age set you back. If you want to do something, you just need to pursue it, because it's the passion that we've got to drive us forward.
Yeah, and I think that's the main thing. If you've got the passion and the drive to stay clinical, to want to advance, to make a bit more of a difference, the course isn't easy, but it is well worth it.
I think that's what I hear from some of my corporate colleagues is when they go to the corporate side or the managerial side, they always say the same sentence: I miss doing the groundwork and being there in touch. So to have an advancement means that it just allows you guys to have a more qualitative career, essentially, because you get to stay doing what you love, which is helping the community, helping the people, and seeing the recovery. So yeah, it's definitely. And I'm glad we got to talk about this, because it is a role I think that it doesn't get a lot of light. We don't share too much about it. So to have a week to celebrate it and show off your role and sort of allow others to see it and also come in and innovate as well, because it sounds like with it being, fairly new, obviously it's got the qualification and the grounding. It does allow others to sort of come in and experience that role. So good to know that members of staff can contact others to shadow. Who do you think, what sort of roles would want to come into this? Like, is it like your band, like 4 nursing, 5 nursing? Is there a specific criteria, or can anyone think about becoming a advanced practitioner?
I think for me, it was kind of something quite early on in my career that I definitely aspired to be as I progressed. So I think that kind of sort of guided what opportunities I saw out. So when I did progress into my band 6, I opted to be the clinical lead nurse as opposed to the deputy ward manager. And then it was a case of tapping into the AMPs that I did work with on the ward and sort of seeing what opportunities were available, what learning I could do. So I suppose really just using it to sort of guide what path and what sort of opportunities you look for in your job is what I'd advise.
And I take it, Rachel, you've never looked back since.
Oh no, a few assignments maybe, but other than that, no.
Nothing wrong with a bit of education. Challenge you, keep you up to spec. And that also is the development, and that's good that the trust offer these positions to develop your roles, because the last thing you want is to be in a job, not happy, not being fulfilled, and also not feeling like you can progress. So, and it does sound like from both, well, I don't know what Anna thinks, but obviously from Rachel's side, you've grabbed it and gone for it, and you've really enjoyed it. Is that the same with you, Anna?
Absolutely. I mean, I love the library. Kiel Library, me, are absolutely paired together. But like I said, I've loved the knowledge and I like sharing the knowledge as well. So I would definitely advocate anybody, if they feel like doing it, definitely do it. Don't wait, keep pushing forward and enjoy it, because I've enjoyed it, although the assignments are hard. But the benefit is actually in clinics when you see your patient improving, and that's the best bit.
And no one said they were easy, though. That's the thing with assignments. I guess as well, just one final point before I wrap this up is obviously your role is kind of leading in the wards and the clinical setting. Obviously, you must collaborate with the rest of the team and be sort of a figure to collaborate with them and bring the quality to the clinical space.
Yeah, I think it's kind of like carving out that it was almost in the teams that I've been in, because I've been in a few teams where I was kind of the first advanced practitioner. So it's kind of like carving that other role out of, whereas traditionally people will have gone to the manager or the deputy for those sort of things, but to have that other kind of senior clinical role where people can come and be like, oh, what do you think of this? Or this is what I'm thinking of doing. What do you think? It just offers that other level as well. So there is that kind of senior clinical leadership role that kind of I don't know, seems by osmosis you just kind of develop as you go along.
And I think what you've touched on a lot on is it's a lot of experience. Obviously, you talked about that patient scenario with the taste, but you can also make the role your own, and it's taking your own experiences and using your words, carving that role into the sort of lead that you need to be on that in the clinical space to sort of bring the advanced practitioner to the ward or the community space or wherever these advanced practitioners can be? Because actually, I know some of you are ward based. I don't actually know where all of you have come from, but I imagine it spans across a lot of combined.
There are a few of us now. I think there's about 36 in total, including our primary care colleagues now. So we do span across. I think you've only got a bit of a snapshot here of just us from older adults and inpatient adults, but we do span across kind of the CAM services, the adult community services as well. So we are becoming a bit of a stronger force than we were a few years ago.
And just a question about recognition of the advanced practitioners. Is there a uniform? Obviously, we have uniforms in combined that show the different job types and all the different, medical nursing roles. Has the advanced practitioners broke into the world of their own branding, shall we say?
So we do have a uniform on the ward, yes. So we wear a black tunic or dress with the white piping, and that's how we're identified, really.
So for anyone who wants to spot them, they're in their, well, combined, they're in their black uniform. I think that's it today. I think it's been great to meet and speak to you all, and obviously you're very passionate about the role, and it's good to hear that it's a different way of working, and it shows the NHS is always advancing and trying to find best ways to obviously make patients better, also give you guys career opportunities that meet the, I want to say needs, but meet your passion for the clinical side that you do. So thank you very much for coming on and raising awareness, because you never know, someone might be listening to this and think, I've been struggling in my career and I want to go somewhere and I want to keep it clinical, and hopefully what you guys have said today will help with that. So thanks for coming on the Accommodations Podcast. If of course you're new to listening to this podcast, we post on Apple Podcasts, Spotify and SoundCloud, and we talk about all the insights of North Staffordshire Combined and what goes on behind the closed doors. So we try and give an insight to the clinical, the nursing, the mental health and everything that happens at our trust. So thank you everyone for coming on, and we hope to have you back maybe next year to talk about the new innovations that the advanced practitioners are doing, and hopefully Anna and Rachel, you won't be trainees by then. You'll be hopefully fully qualified and ruling the wards and the community spaces. Thank you very much.